Hello, my name is John Salmon and I am a consultant ophthalmic surgeon in Oxford, England. I am the author of the new edition of Kanski's Clinical Ophthalmology. I had three aims when given this task. Firstly, to maintain Jack Kanski's unique approach of presenting core knowledge in a systemic and succinct manner, covering the entire field of ophthalmology. Secondly, to obtain the best images of the whole range of ophthalmic disease. And thirdly, to update the text, including immunotherapy, genetics, and new technological developments. I am particularly excited by the images in this 9th edition. In the book, you'll see we have beautiful pictures of common conditions. For example, herpes simplex and dry macular degeneration. There are also images of uncommon conditions, and here I needed help from colleagues from all over the world. For example, congenital cataracts, trachoma, which of course is not a problem we see in the developed world, but which is very important in places like Africa, optic nerve glioma, and then conditions that are disappearing because of new therapy. For example, necrotizing scleritis. The updated text includes simple approaches. For example, beta blocker treatment for capillary hemangioma, the latest in immunotherapy for inflammatory eye disease, thyroid eye disease, migraine, the new approaches in glaucoma surgery, MIGS. I have included new OCT images, for example, OCT of the back of the eye and in VKH, and a section on OCT angiography. I hope you get as much enjoyment from the book as I have obtained from preparing it.